Hey there, it's Hoang. How's everyone doing today? I just wanted to come on and do like an impromptu live um, because the May exam is coming right around the corner. And if you guys are studying, I hope this can help you. Um, I noticed you guys are just like weeks away from the exam. If anyone is thinking about taking it in November, I hope this can help you even more because you'll be, planning ahead, right? So we all know that when it comes to the CHT exam, the outcome is essentially like a 50-50 split. 50% of people will pass, which then means 50% will fail. And in some years, it's a little closer to 60% pass rail, but then 40% is still like a huge chunk when it comes to the pass fail rate, right? Um, and it can seem really overwhelming. It can seem really overwhelming and even discouraging if you're an occupational therapist, if you are a physical therapist and you want to become a certified hand therapist, just hearing those score ratings and those score outcomes can seem really overwhelming or even discouraging when you're attempting to study or even when you're attempting to take the exam pretty soon. So how do you study in a way that will set you up, to be one of the 50% to pass? So I'm gonna talk a little bit about that. My name is Hoang with Hand Therapy Secrets, and I help people be the CHT before you become the CHT. And I often talk about being like embodying, embodying what it means to be a certified hand therapist before you actually get the letters behind your name. And a lot of that comes down to really critically thinking through and problem solving a particular case, right? And then being able to make decisions around that particular case in terms of what needs to happen next. And this can come from, surgical cases, come from non-surgical cases. Now, I know a lot of certified hand therapists, they have a tendency to work with surgical cases and complex cases and things like that. But when you're a certified hand therapist, you can get an array of different types of cases, and that's what makes the profession so fun, so challenging, right? So that there's always something new to do, something new to learn, and I think that's what gives our profession like real longevity because I haven't been bored yet. you know, Even if it's a flexor tendon. Now, sometimes I do get bored with flexor tendons, but for the most part, there's a lot that we can do to help the people who come to see us. So when it comes to passing the exam, like what are some things to think about? What are some things to consider? And that's what becoming an expert, oftentimes I'll talk about, becoming an expert because when you are a certified hand therapist, people do look at you a certain way. People do approach you a certain way and they're like, maybe you know this to help me, maybe you know how to do this to help me. And people come to you, they can come to you with mild stuff. Sometimes we think, oh, arthritis might be mild, right? But for the person experiencing arthritis, it might be more severe to them, can be getting in the way of their function and how they feel about their hands. And a lot of people, they feel old when they have hand injuries. Or like you hear the word arthritis. Like I had somebody who was like, oh, to hear the word arthritis, like, oh, thank God I don't have it, because it makes people feel a certain way. But anyway, um, people are coming to you for answers. People are coming to you for advice. People are coming to you for opinions. What do you actually know to do? What do you actually know to do based on evidence, based on research, right? So people aren't going to just for you to regurgitate like what they could have easily found on Google, right? And so that, I think that's the biggest difference. Like when you're an expert, you have some answers for people. And that's why I'm so passionate about like helping people become certified hand therapists because first of all, I've always believed that when you become a certified hand therapist, that there is like this ongoing desire that you have to constantly learn and constantly improve your craft. And I think that's what it means to become a certified hand therapist, that as a certified hand therapist you have to spend a little bit more money on your education. You've got to you hold two certifications, right? It's a national certification, so you have your certification to be an OT or PT, and you have to renew that every 2 years. But when you're a certified hand therapist, then you have to renew again after 5, and it actually doubles, essentially double the amount of continuing education that you have to do to continue holding on to it. So I think there's a certain level of like that internal drive that you have to want to be really be that expert in your area and to constantly learn and to constantly grow. So I've been helping therapists for several years now. Actually, formally through Hand Therapy Secrets, this is our 3rd year running these type of programs. But even before then, I was helping, people in my local community. I was helping my own staff members. I'd hire people and I would help them, train them, and then help them essentially move towards becoming a certified hand therapist. And there's 2 major areas that I always think about and consider, and hopefully sharing this will help you kind of chunk that type of information down as well. And I always talk about the knowledge side of it and then the mindset side of it. And we spend a lot of time talking about nerves, talking about anatomy. Sometimes people think like you have to know the ins and outs of anatomy. And I don't think we need to know anatomy in that sense, in that the way we had to learn it in grad school or undergrad school. But that's where, your knowledge centers, that's where your anatomy, just knowing a certain amount of your anatomy, knowing your nerves, knowing the different types of tests that you can do, like clinical testing that you can do, having to memorize certain things like those names, knowing how to actually perform them, or how to break down like a certain activity. Those all fall under knowledge center. Um, Knowing principles of splinting and then knowing how to then apply the principles of splinting is a really huge component too of the exam. Knowing the positions, knowing how to pick them versus picking one type of orthosis versus another type of orthosis. So that's all like under the knowledge center. And if you're new to following me, or if you've been following me for a while, don't forget that we put up a lot of information on YouTube. So you can go Hand Therapy Secrets YouTube, and actually there's a lot of videos. And actually I've been sharing, I've been getting, since we're doing a workshop, and even with my students that we have, there's a lot of questions on splinting. Do you know that I have a lot on YouTube in our showcase, like in our not showcase, that's inside the program. But we put a certain amount of free videos out on YouTube, and it's on a playlist, and you could look those up, check those out. There's different skills, that I showcase and share on YouTube as well, and we're starting to share a lot of that stuff on our podcast as well. That's more of like an auditory experience where you just come in, you're listening. But the YouTube gets you to see it, and then we have inside the program we have libraries of like even more videos and more how-tos. Um, but when it comes to studying for the exam and taking the exam and passing the exam, not only do you have to consider what do you know and how do you know them and how do you apply what you know to answer the questions in a way that gives you the best possible chance of passing. But the other component of knowing all those things is your mindset, and that's like your mindset area. That's where I feel like we most neglect, right? Let's face it. We're taught to just like do. We're just taught to do and to just brush everything aside. But at the end of the day, we're human beings, and there are things that are meant to be hard, and when you struggle through some of it, it gives you a sense of reward because If it was easy, like everybody would want to do it, right? But when it's too hard, it can be so discouraging that you don't even try, right? So when it comes to mindset, there's a couple of different aspects that I often think about, and I want to share it with you. Um, in the mindset center, if you don't take care of it, if you don't do things to foster not just positive thinking, but different strategies, so that you can keep going, so that you can approach the exam in a certain way, so that you can approach difficulty in a certain way, it can really hurt you when it comes time to sit for the exam. So, um, before you even get started with before you even study, or before you even like sit for the exam, you've got to go way back and talk about like, what do you really want? I have to talk about like, you want what you want, what you want. If you want to be a certified hand therapist, you want to be the best hand therapist in your area, then be it. Like, have no excuses, have no explanation, have no justifications for it. You don't have to say why. You can just say, "I want what I want because I want it," you know? And then that is a courage, I think, that is required to do something that's hard. And the only reason that it's hard is because you're not yet good at it. We've been students in our therapy field for years, so it feels really comfortable to be a student. You go from undergrad to grad school, and then like it's so many years of schooling that it becomes easy to be a student, easy to be being told what to do, what classes you need, that you have to get an A, you have to get a B, and then you have to do your internship, and you have to do things the way people tell you to do it. And then when you come out of school, then you're like, oh, I'm an adult, I'm on my own, what am I gonna do? Right? So it takes courage to decide to do something hard. And I think when you hear constantly, I heard constantly in school that hand therapy was hard. I still hear from other people who are in school that are being told the hand therapy is hard. And so when you keep hearing it, there's absolutely no reason why you wouldn't believe it, right? And so part of becoming a certified hand therapist is to make that commitment and to, to do something courageous, to commit to doing something where you haven't yet done it. So of course you're not that great, right? So it takes courage and it takes commitment because you know that you need so many years, you need so many hours, and you're working with some complex cases that you need to study. Like, but studying for the certified hand therapy exam or studying to be really good for what you want to be able to provide for your patients is a different level of commitment. But taking that commitment, even though you're not 100% certain that you'll pass, but you're committed anywhere. And it really does take courage and commitment to do that. And then the other thing when you're making that commitment is to developing your skills, right? So it takes time to develop the skills, it takes time um, to develop that knowledge. But in running the program for the last several years now, I've just spoken to like countless therapists, whether they be PTs or OTs. I've talked to people in various different settings who work in different settings, who live in different states, who live in different countries, who have different backgrounds. And it's really fascinating to just hear like their experiences, what they go through. And I just wanted to share some of that with you because I think that the people who study for the exam and take the exam and are committed regardless of the results, that they have those three things. They have the courage, they have the commitment, and then they're, with the courage and the commitment is how they develop their skills and develop their continued knowledge, right? But here's what happens. Whew, when it comes to taking the exam, no matter how hard you worked, because I think a lot of people work really hard that doesn't necessarily determine whether you're going to pass or not, right? I think that there's a lot of people who fail that worked really, really hard. And I don't think that hardness or the amount of time that is, um, spent studying is like the only thing. I think there's other reasons that don't sit under that like knowledge centers, that sit under the mindset center, that really can like F you up when it comes to the exam, right? There's always a certain, there's three main reasons. There's three main reasons what I've noticed where people tend to have like where they tend to fail, right? And these are just my the data I've collected, right? Just how do you say it? Like informal data collection, informal data collection. Um, there's three main reasons why you'll fail, right? And one of the major ones is desperation. Desperation. The more desperate you are to pass, the harder it is that you make it on yourself. Every time I've worked with people who have failed, one thing I've noticed is the level of anxiety, right? Uncontrolled anxiety, uncontrolled negative thinking, or a false sense of positivity, right? Like trying to fake your brain into thinking that you're positive, into thinking that things are good, um, are some of the things that I've kind of noticed. But I would say all of that kind of falls under like this umbrella of like desperation, like that you have to have it or else. And you're a therapist. Like it isn't like you won't lose your license if you don't become a certified hand therapist. You'll still be able to work. You'll still have as many chances as you are willing to take to pass it. So, that's one of the main reasons why I've noticed when people failed. It's that deep sense of desperation. It's that uncontrolled anxiety that I've noticed. Number two, one of the other main reasons where I notice that people fail is they're focused on the wrong things when it comes to studying, right? There's a lot of topics, there's a lot of information that needs to be remembered, that needs to be applied. But if you're focused on the wrong things to study, it can really throw you for a loop and have it where you're not able to feel good about the questions that you get to answer on the exam, right? And then the third main reason why I notice, when I talk to people, and this is all like, again, I said informal calculations, informal gathering of knowledge. And when I'm talking to people to find out what's going on, how did they study, what was their background, that kind of stuff. And it's really the inability to apply the knowledge that they know. So I think that there's so many therapists when they fail, it's not that they didn't sit there and memorize the shit out of everything. Like, you know, they memorize, they studied hard. And I'm not really great at memorizing. Like I'm one of those people, I'll tell you, I'm a really bad test taker. I don't do well with standardized exams. If you knew how my scores were, before, just trying to get into college, they were not great. But I had pulling from my past, I was able to say to myself, like, okay, so I know that there's certain things that I'm not good at, and just being really honest with myself and what I needed, so that when I approached the exam, I approached it very realistically. So I knew what I needed to focus on. And so focusing on the wrong things can really hurt you in terms of taking the exam, but also not being able to apply the knowledge that you do know can really hurt you as well. And when you're focused on the wrong thing and you're unable to apply that knowledge, you know it. So then it's going to lead you back to a certain sense of desperation. It's going to lead you back to a certain sense of anxiety. You can get easily distracted, whew, especially closer to the exam. Like you guys are like 2 to 3 weeks away if you're taking the exam in May. I mean, talk about distractions. They're coming up. And you know, when things get harder, we allow those distractions to come into play. I have stuff that I really needed to do today, and I would like one family thing after another. I mean, total distraction, right? Tomorrow's another day. I'm gonna have to get my mind right. So you do too. You're going to have certain things that come up that you can't necessarily block, but you're going to need to have strategies in place to know how to handle it, deal with it, so that you can put yourself in the right mindset in order to deal with these things. And I think also, you know, it comes back down to your studying. How have you been studying in a way that can reduce any of those problems so that you're putting yourself in the best possible position to pass, right? Everything is like the questions change. I don't know the questions. I don't have an insight into questions. All I know is that we have to, as a certified hand therapist, when I get cases that come my way, I have to be able to look at that. I have to be able to critically think through what is the problem, what's wrong, so that I could have strategies to help get the results that they're hoping for. You know, one of the biggest things is, you know, when you get a surgical case, not only are you dealing with that surgery, but you have to have a certain amount of foresight to understand what are the potential problems. And then how do you get ahead of those problems? How do you help them to get ahead of those problems so those potential problems don't become such bad problems, right? It's that type of critical thinking and that type of decision making that is really needed in hand therapy. And it could be shoulder cases, elbow cases, wrist cases, hand cases, any kind of hand and arm types of cases. But that's what's required of you in the field, in the clinic. And so if that's required of you in the field and in the clinic, those are the type of questions that you should be getting on the exam. Like, I wish it was just so simple. It's like, did you remember this? Well, what are the choices, right? It's not that simple. They're just usually going to provide you some kind of story. There's some kind of clues in the questions, and you have to be able to break it down in a written way. Whereas, like, in the clinic, you see it, you talk to, there's auditory, you get all this feedback. But on the exam, it's such a one-dimensional field, but you have to be able to still think three-dimensionally, right? So, so when you study in a way that helps you understand concepts versus just studying to memorize, when you're able to cover majority of all the topics, the major ones that one topic can then build the foundations of the other topics, so it doesn't feel like you're just studying from scratch, like you don't know anything. Of course, you know a shit ton of stuff, right? That will help you with the feels that you're going to get, the feelings of desperation, the feelings of anxiety, so you can manage it better, right? So those are the three reasons why you might fail. Here are the three main reasons on how to pass, right? So if those are the three main reasons on why you might fail, here are the three ways in which you can set yourself up in a better, to increase your chances of passing, essentially. And that's like having to that's having the ability to shift your mindset. That's having the ability to shift your mindset. And when you're in a community where that's where that's where that's a focus, right? It's easier to shift those mindsets because you're getting support along the way as you're studying, that it's not so hard like you're trying to cram your mindset shit 2 weeks before the exam. You've been doing this the whole time, You know, you've been adjusting yourself this whole time. But the mindset shifts are really, really key. And one of them is to look at the progress that you've made. Our brain is so accustomed and it's so easy to think of the things that you don't know. It's a very like this is protect your brain is constantly in protection mode. And so it's constantly going to be like, what do we don't have? What do we don't have? Right? What's wrong? What's missing? And it actually takes a lot more effort to think about what have we done? What is our progress? When we focus a lot more on what we've done, what's our progress? What do we know? That can actually lead us to see and to be more positive, but not the fake kind of positive, the real kind of positive. How do we take what we already know and apply it to something that we think we're not sure of to essentially give us the answers that we're looking for? Does that make sense, anybody? If you guys are watching this live, or if you are watching this on replay, feel free to leave me a comment. Let me know, if this resonates with you at all. The exam is, there's a lot to the exam, but I think that there are ways to make it more manageable. There are ways to make it less overwhelming, and there's definitely ways to make it easier and more enjoyable. But if you're struggling with something, leave me a comment. Let me know. It's something that we could, discuss at another time. But yeah, but if any of this makes sense, leave me a comment. Let me know if that makes sense for you too, right? But as you're going into the exam, as you're thinking about studying for the November exam, really think about, that looking for successes along the way instead of looking for what's lacking. And sometimes having that knowledge base, like learning as you go and having at least 75% of the material of the understand like a good understanding of the material that allow you to feel like you are the problem solver and that you know how to think through something will give you that boost of confidence, will give you that boost of um uh or not boost, but yeah, boost of confidence, but it will squash. Like when you boost confidence, you squash self-doubt, right? You don't have confidence and have self-doubt all at the same time. It's usually or the more self-doubt you have, the less confidence you have. And the more confidence you have, the less self-doubt you have, right? So that's the juggle in which we have. And it's going to go up and down as you're studying. It's going to go up and down as you take the exam, but the more and having that key understanding will really help you so that you can feel more confident and that you could better squash that self-doubt, right? Having a good understanding of that knowledge base and knowing where to put your focus, choosing where to study, choosing what to study, what resources are the key resources that work for you. I've talked about this before, and I have videos on my YouTube channel about the different resources. I'm a huge fan of Rehab of the Hand. I understand not everyone wants to read it. I understand nobody wants to effing read it. It's like hard material that the way it's written, it just they don't make it easy to understand. There's a lot of jargon in it. It's written by a lot of different authors, and so the words and the concepts it changes a little bit. So I can tell you right now that majority of people who are in the hand exam prep program are in it because they don't want to read the Rehab of the Hand by themselves. They're coming in because they're watching the videos, and then they're going to scan the chapters, look for key pieces of information, but they know where to put their focus, right? And then knowing which resources are really good for you to study from helps, because otherwise you might have so many resources that you get confused. Actually, I had someone when she failed the exam, she was like, I'm buying this other book. And I was like, what are you doing? Why are you buying another book? And she's like, because I think I need it. And I was like, what do you need it for? And the book was so much more than what she needed in terms of details. And if she had spent time looking there, she would have taken her focus off of applied knowledge, and she would have gone all the way into anatomy and kinesiology beyond the scope of what we really need to know as a certified hand therapist, right? So, one of the main ways to ensure that you pass is knowing where to put your focus, knowing what resources really help you to study and what resources are not good for you to study from. I've had people cannot study from the rehab of the hand. So that's one of the main reasons why they're in the program. But every other resource, if you really think about it, always references back to the rehab of the hand. Every single one of them. Every single one of them. Right? So there's some key informations in there, and she just used a program to really help her. So she didn't have to read, and she used other resources, but she knew how to use it to her benefit, and that's the key thing. And the third reason or main reason um, that you can study in order to pass is just to ensure that you apply the knowledge that you're learning, right? It is not about how do you do it. It's about knowing how you would do it. So I had this question, I think last time I went on a live, and the question was, do you have to know how to make a dynamic splint, right? You don't have to know how to, but you do need to know the principles of it, and you do need to know if the choices are there or the questions are there, how you would visually see that dynamic splint, right? Another example is like you might not do a lot of manual treatment to a shoulder joint, but when there's a question on the exam about providing manual therapy services on a shoulder, you need to know how to break down that question and look at the choices potentially, or look at the choices, or the story will be in the question, and um you would have to see how they break it down and know, are you pushing someone's humerus into the posterior capsule, are you pushing it anteriorly, inferiorly, superiorly, right? You're never pushing superiorly, by the way. So, so if you see that, that's not a choice. No, I'm just kidding. I don't know. You have to look at the question, but there's a lot of clues in the questions. But it really comes down to. Oh, sorry. Let me. It's getting a call. It really comes down to what is it doing? Oh, sorry, Instagram. um it really comes down to applying that knowledge of yours, so that you could critically think through, problem solve, and then make a decision. In the clinic, you're making a decision on what to do, right? How am I going to move them? How am I going to arrange them? Which exercise am I going to pick? Which ones do I do first? Which ones do I do second? On the exam, you're going to rule out and you're going to rule in based on the question, right? And that's how they test applied knowledge. So think about, like, you know, think about those main areas. Think about like what might cause you to fail, what might cause you or help you to pass, and then ask yourself some key questions, right? Ask yourself some key questions. What are your painful areas right now? You know, Are you dealing with the pain of having failed a test prior? If you failed a board exam, how are you feeling? If you failed any kind of other certification exam, that the pain of that particular failure it might bleed into this one, right? And then as you get closer and closer, what are you doing to handle that level of discomfort, anxiety, things like that, that can really hold you back again, right? What is another painful area? Is it getting through the material? Is it the reading? Is it the lack of support? Is it the not having someone be in your corner to help answer questions in a way that's easy for you to understand and apply so you don't have to waste a lot of time? So think about some of those areas, and you know um, think about what do you really need right now, right? If you are going to take the exam in May, you have a short window of time to really explore this and ask yourself some key questions like, what do you need to work on right now? Could it be a little bit of mindset? Do you need to work on some mindset stuff to put you in the best possible shape to take it? Are you reviewing some key areas that you are weakest in? Like, don't forget to study the area that you're weakest in, you know? That's the hardest part, right? Like, we don't want to do the things that are super hard. So, but make yourself. That's part of the job. Is do the hard stuff. Do the hard stuff now, and you're going to enjoy the fruits of your labor later when you get to pass. You get those three letters behind your name, right? So, think about, what do you really need right now? If you're taking the exam in November, really think about what you need right now. We're about to open up. We're ending our cohort currently now and helping them take the exam and pass in May. But we do have a certain amount that started a couple months back, and they're moving through to the November exam. So if you're someone who's interested in joining that current group to move to the November exam, you've been studying on your own, but you're starting to think like, shit, it's really painful being overwhelmed with all this reading, not really sure what to study, not having the support of someone to ask questions, someone who can really, where you feel safe asking questions and getting clear explanations um, of why something works and why something doesn't work. If you're looking for, any of that kind of support, if you're looking for any kind of help to get through the thick of the material, if you're looking for, if you don't quite have the experience, and you're looking for someone to help you get through all that material, then let us know. I'm going to include the link. You can actually just go to handtherapysecrets.com as well and grab the details of the hand exam prep program. I'll be opening up my schedule over the next several weeks to talk to anyone who wants a discovery call, where you know that you want to take the exam, you know that you need some help, and you just want to see if if the program that I run will be helpful for you, and we can have an honest conversation about what it is that you're looking for, right? But those are the two biggest components. Nobody will ever talk about mindset. No one ever talked to me about that for sure. It was like, I used to have to do it by myself. So, if I had to do it by myself, then you should have to do it by yourself. But we don't necessarily live in a world where we have to do everything and struggle all by ourselves, right? We really don't. Um, I've really built this program so that I can surround myself with people who aspire to do what I'm doing, which is to be a great hand therapist, right? I've built this program, and I talk about mindset because I never had that. It was just like, bear with it, grunt, just do the work, just suffer alone, and there wasn't always a safe person to ask questions to. Sometimes you work with them, and let's face it, there's some judgment there about, like, oh, if you ask too many questions, they might think that you don't know what you're doing or don't want to know what you're doing, or like all sorts of stuff. Or you want to ask these questions, and you do ask a lot of questions, but they don't really have the time to really dive in and to give you that full on explanation. Um, And there's nothing worse than asking a question because you don't know, and somebody just chucks a chapter or a book at you and just be like, read this. Like, hold on, I'm asking a question because I did try to read it and I still didn't freaking understand it. I need someone to like say it to me in a different way. So sometimes there's that safety of like just having a key person or having a community where you could safely bring your questions to, and that you're not being judged for it. There is this fly, this gnat that's just driving me apeshit bananas. It's like on like I don't know, just driving me crazy. Anyway, enough with the distractions. We've got to get you ready, we've got to get your mind ready, we've got to get your skills prepared to sit for the exam. So the May ones come in, let me know, leave me some comments, hit me up in direct message if you have, some struggles, some concerns of yours. But if you're looking to study for the November exam and you are ready for some help, you're ready to make that commitment, and you want to do it, you want to become a certified hand therapist, you're just looking for that help and you're saying, I don't want to do it alone, is this program right for me? Let's have a conversation with about it, and I'll send you some details of the program. So it's that simple. It's that easy. So that's it for today. I hope this really helped you. I hope it really brought some light and attention to an area that really doesn't get spoken about, and I hope to share like some more data over time as I see what works and what doesn't work with people taking the exam, right? Oh, and if you've taken the exam before and you failed, I do a score audit um, that can help guide you in terms of, again, where to put your focus. How do you study in a way to increase your chances? Because it's not just like, let me blindly guess um that I just didn't know everything and have to study everything, because it's not everything. You know so much. I mean, so many great therapists who know so much information, and sometimes it's just like that little itty bitty thing that you can't see, that having a second pair of eyeballs can see. It's just like someone coming to you for therapy. They can't do the thing that you know how to do because they either one can't see it or two can't hurt themselves in that way, right? So they're coming to you as a therapist, as a coach, as a mentor to help them through it. And this program is, really similar to that. So sometimes we can't see it because we're so close and we're so deep into it. That we need a second set of eyeballs, a different group to take a look and to give us some insight and where we don't see. This is one of the main reasons why I am in different coaching programs, because I can't always see um, if I'm inside the box, right? There's a saying about that, but I can't remember it exactly. But if you can't see what's going on outside when you're inside the box, and so that's the kind of like metaphor, like sometimes you just can't see it too. Being on, having someone on the outside see it can really help guide you so that you're not wasting a lot of time, you're not wasting a lot of heartbreak, and you're getting more focus and increasing your chances of passing. But I'll leave the link. You can always hit me up if you need any help, if you're struggling a little bit for the exam. All right. Thanks so much for tuning in and watching. If you watch it on replay, then by all means, message me and let me know what was good, what was your takeaway, and I hope that helps. All right. I'll talk to you guys soon. Bye. Have a great night.